Hey guys, this is Blake LeVine.
And this is Jennifer LeVine.
And we are the founders of a website called BipolarOnline.com. In this video, we're going to talk about depression and bipolar from both a therapeutic standpoint and from a medical place. Jennifer is a physician assistant, and I am a therapist and social worker. First, I'm going to talk about depression and bipolar through therapy. It's often helpful to learn to deal with the behavioral issues relating to depression and bipolar. When you see a therapist, you can talk about the issues in your life, your family, your finances, all the problems, and the therapist will give you often cognitive ways to handle your emotions. They'll give you techniques and strategies, but it's also very vital to get the medical help you need, and Jen will share a little bit about that.
So yeah, I tell most of my clients and patients that I think the best way to treat any kind of mental health problem is really a combination of medication and therapy. I think both recognizing what behaviors you have really is best to talk about with a therapist, but also medication on a daily basis can really work on the neurotransmitters that you might be lacking in your brain. So a combination of both, I think, is the best way to treat any kind of problem or pathological mental illness.
Well, in my own life, I dealt with bipolar disorder, and in the background you might see my young children going around because we're happily married and we have 2 little kids, but it's so important to seek help and treatment, whether it be with a therapist or a psychiatrist, to get the help that you need. Now, what we do as a company is we work doing coaching. Jennifer or I and our team will motivate you, will listen to you, and will help you get the courage to deal with the issues you're facing, because in your life it is never too late to take positive steps. Jen, I want to ask you, you dealt with depression. What are some of the lessons you've learned that you would share with others that face depression?
Well, I think depression, you can really get into a bad place, and I think just by telling people you're depressed and admitting to it is the hardest thing. But people are allowed to be sad, and you do need people that you love to help you and help get you the help that you need. So I think the first thing in anybody who's really depressed is just being honest and saying, you know what, I am sad, and how can you help me?
That's huge. And for me, it was a big deal to admit that I had bipolar disorder. I was nervous people would judge me or make fun of me, but I've learned that it's better to be open and to get myself mentally healthy. And you know what? You can have a family. We're happily married. We have 2 children.
We're not saying it's easy all the time. We definitely have to work together, because taking care of kids is the hardest thing in the world, but the most rewarding.
Yeah, and I think teamwork is huge. What would you say, Jen, is the importance of teamwork when your loved one or you face depression or bipolar disorder?
Well, I think that having a mental illness and with children can be so taxing, because it takes so much energy to watch the kids and to always try to be on your best and to act your best and to put your best foot forward can be challenging. But if you have someone like a husband or even a mother or father who loves you, let them be supportive. Tell them, hey, listen, I need help. Can you watch the kids for an hour while I can go do something for myself and recoup, and just remember that you're important as well.
Yeah, Jen was great. Today she gave me a couple hours to go hang out with the kids and do some fun stuff. And I want to encourage you to check out our website. It's BipolarOnline.com. We offer coaching. You can go get a free initial session by going to our website. We also have written books and have a lot of knowledge to share. So thanks for watching this, and I hope you have a great day.
Take care. Hope to see you there.